Okay, so the second session of the anti-cancer agents, that is common toxicities with the anti-cancer agents and their management. And the learning objectives of this session are to know which organ or which systems are affected commonly by the cancer chemotherapy, to know which are the common adverse effects with the cancer chemotherapy, and how to manage these common toxicities. Right? Now, as the cancer, we have discussed that there is uncontrolled proliferation of the cell. So, obviously the anti-cancer agents that target this rapidly proliferating cancerous cell, but at the same time, as I told you, they are not able to differentiate between the normal and the abnormal cell. So, the rapidly proliferating normal cells are also going to be killed, and hence the adverse effects related to that will be there. So, in short, in our body, those cells which are rapidly multiplying, they are also the target of the anti-cancer agents. Now, first I will just enlist the common toxicities. So, the target organs are bone marrow, gastrointestinal tract, lymphoid tissue, skin, gonads, fetus, uric acid, and secondary cancers. Now, first the bone marrow. Anti-cancer agents, they will causes depression of the bone marrow. Okay, and because of the, you know that the bone marrow is the site from where the RBC, WBC and platelets are synthesized, and that's why it will be reflected into aplastic anemia, granulocytopenia and thrombocytopenia. Okay, we will discuss in detail. Because of the granulocytopenia, there is because you know that the WBCs are the major defense mechanism in our body, and that's why the increased susceptibility to infections. And because of the thrombocytopenia, there is increased chance of bleeding. Now, how to manage these infections and which infections are common? The fungal, viral and bacterial, and amidst fungal infections, the candida as well as the pneumocystis jirovecii pneumonia, these are the common. In the virus, the most common one are herpes zoster and cytomegalovirus, and in the bacteria, toxoplasma. So these are the common infections. Now, how to prevent the development of the infection? Obviously, once the infection is developed, then you have to give the appropriate antimicrobial regime. But if it is bound to occur the infections, then we have to give some agents which prevents the decline in this WBC count. And this can be possible with the help of injecting granulocyte colony stimulating factor and the granulocyte monocyte colony stimulating factors. Okay. And next is the lymphoid system or lymphoreticular tissue. That the lymphocytopenia, with any anti-cancer agents, there is a significant decrease in the number as well as the functions of the lymphocytes, and because of this, there is a decrease in the cell-mediated immunity as well as the humoral immunity. And obviously, this will be reflected in increased susceptibility to infections. Okay. Now, next most common ADR is the gastrointestinal ADR. And in this gastrointestinal, first we focus on the adverse drug reactions related to the oral cavity. Why the chances of adverse reaction in the oral cavity is more? Because of the 3 to 4 reasons. And first and foremost is, as like in the other part of the gastrointestinal tract, there is a high epithelial cell turnover in the oral cavity, and you all know that because of the brushing and chewing and all that, oral cavity is very prone to trauma. And additionally, oral cavity contains a large source of microflora. Okay. So because of the high epithelial cell turnover, the chances of the damage due to anti-cancer agents will be there. Because of the prone to the trauma, there are increased chances of bleeding, and because of the a very significant source of oral microflora, and there is a decreased immune system of the body, there are increased chances of infections. Okay, so additionally, stomatitis and dental caries because of the xerostomia is also there. So to summarize, there are 4 adverse events, common adverse events related to the oral cavity: bleeding, infections, stomatitis and dental caries. Now this stomatitis is most common with the 5-fluorouracil, methotrexate, doxorubicin and downorubicin. Now the other gastrointestinal ADRs, as I told you that GI tract mucosa, there is a very high epithelial cell turnover, and because of the anti-cancer agents, this cell turnover is blocked. And because of this, there are chances of epithelial injury, epithelial shedding and damage to the intestinal mucosa. And that is reflected into inflammations of mucositis, hemorrhage, diarrhea. Okay. And additionally, with majority of the anti-cancer agents, there are chances of nausea and vomiting. Now what is the reason? The reason is the twofold. One is the direct CTZ stimulation of the chemoreceptor trigger zone, and second is because of the damage to the gastrointestinal mucosa, there is an afferent impulse passes to the higher center, which is also reflected into the vomiting, and which is very troublesome. And cisplatin, cyclophosphamide, actinomycin, lomustine, these are very common agents responsible for very high degree of vomiting. Okay, while the mucositis is common with 5-fluorouracil, methotrexate, doxorubicin and downorubicin. Now this vomiting, it can be prevented as well as managed with the help of, you all know that 5-HT3 antagonists, they are powerful antiemetic agents, so it can be managed with the help of the ondansetron, but they are effective only against the early phase of vomiting in case of cancer chemotherapy. They are not effective in case of delayed phase of vomiting, and for that this aprepitant is effective. And there are many cases in which even these drugs are not effective. In that case, sometimes the steroids, the dexamethasone, is helpful. The skin, again, the hair follicles is the common target organs, damage to the hair follicles, which will be reflected into the alopecia and dermatitis. Gonads, they are again the primary target organs. In the male, it will lead to decrease in the sperm count, that is oligozoospermia and the impotence, while in case of the female, it will be reflected into the inhibition of the ovulation, which reflect into the infertility and irregularities into the menstrual cycle. And if it affects the germinal cell, then it will lead to mutagenesis. In the fetus, there is a significant adverse effect in the fetus, and over and above the teratogenicity, the growth retardation, abortion and even fetal death can be occurred. And majority, I will use this word deliberately, majority of the anti-cancer agents, they will cause over a long period of the time or after the completion of the chemotherapy, after several years, they lead to the development of the other cancers. These are known as the secondary cancers, and the most common are leukemia, lymphoma, and histocytic tumors. Then next, in the cancer chemotherapy, as I told you that these agents, they will cause they kill the rapidly multiplying cell, and because of this there is a massive cellular destruction, and this will lead to hyperuricemia, and these hyperuricemia will reflected into the gout, then increase occurrence of urate stone, as well as it may lead to acute renal failure, and this can be prevented or treated by hydration. Second is, as these urate stone, they are more become insoluble in the acidic urine, so alkalinization of the urine, it helps to dissolve the stone and decrease or inhibit the uric acid with the help of the uric acid synthesis inhibitor agent, that is allopurinol. Okay, so this is all about the common toxicities of anti-cancer agent. Thank you.